and policies designed to prevent and reduce the incidence and prevalence of alcohol and other drug use and consequent health, behavioral health, and social problems. That'll be something as we have our discussions moving forward. We always want to ask the question, what are we trying to prevent, so we can stay on that common consensus on that. So with that grounding foundation, if you again can just brief introductions, and I'm going to start on my left. Wes.
Wes Rivers, he and pronouns. I am ADPC staff.
Thank you. Pam.
Pam Pierce. I lead a substance use prevention organization, Community Living Above in West Lynn.
Thank you. Jennifer.
Hi, I'm Jennifer Epstein. I'm with Song for Charlie, and we are launching the new drug talk program in Oregon.
Thank you. Arnold.
Good morning, everyone. Sorry, I was looking for my unmute button. Arnaud Simon, OLCC Public Health Policy Analyst. Good morning, everyone.
Thank you. Lindy.
Good morning. I'm Lindy Petty. I'm the Alcohol and Drug Prevention Coordinator for Washington County Public Health.
Thank you. Jess.
Morning, Jess Nyworth, she, her pronouns. I am a supervisor for the Prevention Health Promotion team here in Deschutes County.
Thank you. Justin.
Hi, Justin Coet, Prevention Research Scientist with the Social Development Research Group.
Great. Haley.
Good morning. My name is Haley. I'm a health promotion specialist with the Columbia County Public Health Department.
Thank you. Tony.
Yeah, my name is Tony Vesna. I'm the executive director of 4D Recovery. We're a recovery service org. I'm not representing them today, but I'm the chair of the Alcohol and Drug Policy Commission, and then also work on the Alcohol and Drug Policy Commission's adolescent SUD subgroup committee thing, and I'm just going to be serving kind of as liaison between that committee and this committee.
Great. Thanks for joining us today, Tony. Molly.
Good morning. Molly Haynes, she, her pronouns, and I'm the Director of Health and Education for the Oregon Health Authority.
Great. And Mr. Tony Rhododendron. Oh, we got you on mute there, Tony.
Sorry,
there we go.
I was just getting my son, who's visiting us from Thailand, on our internet. Sorry for the delay. I'm at Oregon Research Institute and Values to Action, and I got one thing to talk about at some point, very brief, about this meeting that's going on in Seattle.
Okay, thank you. Craig.
Hi, everybody. I'm Craig Prince. I'm the executive director of the OLCC. It's very, very good to be here.
Thank you. Jill.
Hi, I'm the overdose prevention coordinator for Marion, Polk, and Yamhill counties, and my name is Jill Dale.
Thank you, Jill. Luis.
Morning, everyone. Luis Pimentel. I am the alcohol and drug policy, alcohol and drug prevention education program coordinator with Lane County Public Health.
Thank you, Luis. Mara.
Hi, everyone. Mara Sargent. I use she, her pronouns, and I was affiliated with Benton County as the prevention coordinator, but currently I am 2 days away from finishing my master's degree in addiction policy at Georgetown, and then I will be coming back to Oregon. Exciting updates on that soon.
Great, thank you. Bernardino.
Hello, good morning, Bernardino. I'm the Youth Young Adult Substance Use Disorder Program Policy Coordinator with Oregon Health Authority and the Child Family Behavioral Health Unit.
Thank you, Bernardino. Corinna.
Hi, good morning, Karina Vasquez. I am with the Alcohol and Drug Policy Commission, your executive supporter.
Thank you. Will, I just saw you pop in, Will.
Hey, Debbie, thanks. Yeah, my name is Will. I work for the ADPC as data and research analyst.
Great, thanks, Will. Annalise. Annalise froze. While we're getting Annalise back, I've neglected to introduce myself, Debbie Jones. I'm the prevention specialist in Wasco County and have the privilege of serving as your committee chair. Annalise. We kind of hear you.
Annalise. Policy Committee.
Okay. We might have you turn off your video, Annalise, because you're coming in really choppy. But again, thank you so much, everyone, for being here. This is quite the group. And I really appreciate each one of you being here. Briefly, our agenda, hopefully you all saw that, had the chance to go through the minutes. We're going to do some ADPC updates. We have a great presentation from OLCC, so we really appreciate them being here. An update regarding the infrastructure work group, our charter and membership, and then we'll have some public comment. But that might be a chance where, Tony, we can slip you in with the information you shared, and anyone else will kind of have that be new business as far as that. So it looks like Annalise is going to try and sign back in.
Debbie, do we want to kind of switch the order maybe and have OLCC kick off and then?
Yeah, let's go ahead and do that if that's okay. With Craig and Arnold. Let's go ahead and jump right into that. We really appreciate both of you being here, and I've seen a little bit of this presentation previously, and was really excited about it, and I'm grateful that we'll have a chance to share it with our group and see how we can have a stronger partnership moving forward. So I'll turn the time over to you.
Thank you very much, Debbie, and good morning, everyone. Craig just left for a quick thing. It'll be right here in a second. And I understand, Wes or Corina, you have our presentation and you will be able to present it to the group. Okay, that's fantastic.
So as soon as you're ready, just let me know and I'll start sharing.
And let me, okay, I'll be right there. Let me go find Craig. He'll be right here.
And Debbie, I apologize, I'm back. Hopefully you all can see and hear me now.
Great, thanks, Annalise. While we're waiting, we're gonna go ahead and start with the OLCC presentation, if that works okay with your timeline.
Yep, that's perfect.
Thank you.
Okay, here we are. Apologies for this. We thought we still had a few minutes, but we'll jump right in.
All right. Can you guys hear me okay?
Yes, great.
Okay, thanks, Debbie. So we have several slides here. I'm gonna have to go pretty quick. But again, we just want to start with saying thank you. This is an overview of where OLCC fits into the all of our goal of preventing excessive consumption of alcohol. We'll just get started. I don't know how to advance the slides, Debbie. So really, we're going to start with making clear our public health and safety mandates. If you use the stream or river metaphor, we are upstream with you all. regulating where alcohol is bought and sold in Oregon. And we want to make that clear that that's our partnership, and we are excited to do that. And so I'll give that overview of how we got the system we have. I'll hand it off to Arno for alcohol, the alcohol problem, I think, and then some of the actions we're taking and do take to promote health and safety. And then I'm really excited to share our new strategic plan that is just final. So you're the first group that gets to see it. Slide. I'm going to skip over this really briefly. Just to let you know, we go back to 1933, and the alcohol control model definitely is related to the pre-prohibition and post-prohibition time in our nation's history. And so I'm just going to hit that and move forward. Keep going, please. Okay. So how alcohol is bought and sold in the United States, you have to go back to the pre-prohibition era, which would be on the right, where there really was a very little regulation of alcohol sales. Sales to minors was not something, I don't think, that was strictly regulated. And saloons, you'll see the word saloons mentioned in that early American history, where these were places that generally beer and whiskey were available. The whiskey usually had a higher profit margin and were pushed, frankly. You didn't have a system of making sure that the product was safe through the distilling process. And so that was kind of legalization without regulation. And then we went to the experiment with prohibition on the left, which did reduce consumption. I think the general consensus is it did reduce consumption. It was a federal law. There were state laws that existed beforehand, but it was really an experiment in a federal prohibition of any alcohol 0.5% or higher. So 0.5% would be right there with what we would call near beer, or barely right around kombucha today. And total prohibition was an experiment that our nation engaged in. Had some positives, but also had, of course, bootlegging, smuggling, lawlessness, and some of the corruption and things that we've seen, in some ways similar to the war on drugs, where we've seen the prohibition of substances and the concerns about how it's enforced. So slide, please. So where we came out of prohibition is nationally, we set up as a country the three-tier system. And if you've never heard of the three-tier system, I'll go through it. If you have heard it, I apologize. And I'm sure some of you are probably more expert in this than I am. But the three-tier system is alcohol is one of the most highly regulated substances in the United States. And the three-tier system separates the distiller or the manufacturer or cidery that's in the first tier, those who create the product, separates them from the consumer or retailer with that middle tier of a distributor. So the federal government through the TTB focuses, I would say, the most on the first tier, on packaging. There are federal taxes, making sure that where the product is created is clean and safe. The second tier is incredibly critical. It is where a recall can be done. It's very importantly, where alcohol is imported into the state, and it's where the taxes are collected on most of the alcohol that's sold in a state. And then last but not least is the retail tier, which would be, this is where OLCC does a lot of the regulation that Arno is going to talk about. So what I want to, this is the main point I want to make for the whole morning, is where does OLCC fit into that three-tier model? If you look at it and you think, let's think of two categories of alcohol. Let's think of beer, wine, and cider as one side. And then let's think of liquor or distilled spirits that are over 21% alcohol on the other. For distilled spirits, the state distributor, the state is the middle tier of this system. So the state purchases liquor from manufacturers, warehouses it in Southeast Portland, where I'm sitting talking to you, sets a price, and then makes it available for retail sale. That is called the control model. The control model, how it fits into the upstream regulation, is critical. And that is where beer, wine, and cider are available at thousands of off-premises licensed grocery stores, mini markets. Liquor is separated from those because it has higher alcohol content, and it is only sold through 285 liquor stores sold by agents of the state, so that the alcohol that's most accessible for purchase is the lower alcohol content beer, wine, and spirits. The distillery tasting room is an exception to the three-tier process. And over the 90 years that the control process has been in place, there's been many exceptions. But I'm unfortunately not going to be able to get into those in detail, but keep your chat questions going. So next slide. Why did Oregon do this? It's really encapsulated in the book on top, Toward Liquor Control, that advocated for the benefits to public health and safety of the control model. And it was the recommendation of this book that is still, I think, the primary source of how we got here, and I would recommend it. So Oregon decided to become one of 17 states that controls about 25% of all alcohol sold in the United States, that has a control model for distilled spirits. And this was a new system. It eliminated the old saloon system. It separated the supplier from the retail sell and tried to build on the lessons learned from pre-prohibition and prohibition. And it was largely successful in eliminating bootlegging, making sure that the products were tested and safe. And the goal of it is actually for those who are going to drink, to promote temperance, using the language from the 1930s, by promoting access to the lighter alcohol products and separating those products from liquor. Slide. Here's the language that's in statute for the purpose of the Liquor Control Act. And you'll also find language in section 39 of the Constitution, where this concept of promoting temperance and the consumption of alcoholic beverages, and promoting the consumption of lighter beverages as a means to gain temperance. This is really the control model as succinctly as I can put it this morning. Slide. We're going to talk about cannabis very briefly because there's less history with cannabis. As you all know, cannabis is still federally illegal, so it's still federally prohibited. Hemp is not prohibited. That's another story. You'll see an article last week that a minor league baseball team in Portland, the Pickles, is making available hemp-based beverages that contain THC. But I want to just juxtapose the alcohol system went from prohibition to a strictly regulated at the federal and state level, whereas cannabis is still prohibited at the federal level. There's not a lot of, there's not federal regulation, and the states regulate entirely from seed to sale cannabis. Slide. I think I hit this. 17 control states, 285 access points. When you look at those liquor stores, almost 80% of the liquor sold in Oregon is sold to walk-up customers in those liquor stores. And then beer, wine, and cider is sold throughout the state at licensed entities that would be in the thousands. Oregon's price for spirits is the second highest in the country after Washington. And that is, again, to separate price and access on this. For hemp, going back one, Debbie, looks like you wanted me to go into that. I'm going to go into it really briefly.
Well, I can wait till the end.
Okay, let's go. Let's wait till the end to make sure we get through the bulk of it. But it's a great emerging issue that I want to make sure you're all aware of. Slide, please. So the first priority in regulating access to alcohol in the state is that social control, where we're making the lower alcohol and lower likelihood of being excessively consumed the main alcoholic beverage of choice. However, the second part of our system is generating revenue. And you can see this is the revenue that is generated through the sales of distilled spirits. On a biennial basis, it's $1.7 billion. And then through privilege taxes on beer and wine and cider that are either produced or imported into Oregon, and then from recreational marijuana fees and medical marijuana. And I want to put a big asterisk on this, which is OLCC does not handle the bulk of the marijuana dollars because they go through Measure 110. So they are not shown on this, this Pac-Man. I think the main point of this is most of the revenue generated that goes into the general fund is from distilled spirit sales. Slide. That money is distributed to several points. The big takeaway here is it is unrestricted. It is unrestricted. In other words, the money that goes into the general fund of the Oregon state, which is $327 million biennially, the Ways and Means process and the deliberative process of the legislature decides where that goes. The money that goes to the counties, which is $51 million, and we all know goes mostly to probably jails and services at the county level. That money is distributed by the county commissioners in that county. And then the money that it goes to the cities, which is about 175 million a biennium, again, unrestricted. It is appropriate, it's distributed by the cities. And we all know that that mostly goes to police officers and roads. And in the cities, this is the second largest revenue source for the cities, is the revenue that the OLCC provides. And some of that is spent on alcohol-related things like DUI enforcement, but the determination of what it should be spent on is solely in the hands of the local government entities. The exception to that unrestricted distribution is the Oregon Wine Board has a 2 cent per gallon of wine that is sold that goes to them, as they are focused on promoting the craft wines, predominantly the Pinot Noirs that are produced in the Willamette Valley and other areas of Oregon. Obviously, there's other wines too, but that's the main focus of the Oregon wine industry, is those table wines that are some of the most, top 100 in the world. They often get awards. And then the green slice is 50% of the money that comes in through the privilege tax on beer, wine, and cider goes to Oregon Health Authority for the mental health, alcoholism, and drug services account. So the takeaway here is most of the money is going into the state, the city, and the county, and is not earmarked for any purpose. Those folks make those decisions, and that is not in the hands of the control and is not earmarked in statute. Slide, please. Thank goodness I get to hand it off to Arnaud now, and thank you for your attention.
Thank you, Craig. How is the sound working? Okay. And I'm keeping an eye on the time. I know we prepared a lot of slides for this morning, and I want to make sure we do leave time for questions. So I made sure also to include references in the slide themselves. If you are newer to alcohol and cannabis policy, I wanted to make sure to give you all as much material as possible. I also included my contact information. By all means, reach out to me if you have questions about OLCC policy. The goal today is to help everyone understand what is our role as regulator of alcohol and cannabis in Oregon, how preserving public health and safety is our daily priority. And by all means, any idea of how we can improve that is absolutely welcome. And for now, we'll present a quick overview of what we know of the scale of Oregon's alcohol problem today, what we know are evidence-based policy options to reduce harms, and after that, I'll present flagship OLCC actions to reduce those harms. And then Craig will present to everyone, as he mentioned, a first preview of our almost finalized new strategic plan. Next slide. As a reminder, the main concern is excessive drinking, and as defined in the US, that includes any binge drinking, 5 or more drinks on one occasion for men, 4 or more drinks for women, heavy drinking, more than 14 drinks per week on average for men, more than 7 drinks per week on average for women, any alcohol use during pregnancy, and any alcohol use under 21. One thing I want to highlight is that these definitions come from the dietary guidelines for Americans. These are updated every 5 years. The numbers that I've mentioned and this definition essentially has not been changed since the 80s, but there are 2 new messages that showed up in the current 2020-2025 dietary guidelines. Is first that even drinking within the recommended limits may increase the risk of death from various causes, including cancers and heart disease. And the second message, which I think is really important, is that for anyone, drinking less is better for health than drinking more. And I'm very curious as to where the next dietary guidelines will go, especially with regards to the weekly limit for men if we compare to what Canada, the UK, France, Australia have been doing, based on the review of the current evidence, they all have lowered those weekly limits and so have to have the same limits for men and women. And these are much lower than the current US limit, at least for men. Next slide. Where are we in Oregon? So this chart is, this is based on data released from NIAAA as of April 2024. It goes up until 2022, and it is an estimation of how much Oregonians and people in the US drink on average in terms of alcohol, all converted to pure alcohol equivalent. The line on top is Oregon, and the second line is the average for the US. So in short, back in the 80s, Oregonians were very much near the average in terms of alcohol consumption. But since then, the gap has increased since the mid-90s. And so today, Oregon is way above average in terms of average daily consumption of alcohol. And the three lines below tell you a quick story of how consumption of malt beverages, of beer, spirits, and wine have evolved. For beer and wine, the lines overall have been pretty flat. The one thing that is quite striking, in Oregon, as well as in many other states, spirits have become increasingly popular, again, since the 90s. Next slide. And here's one slide that summarizes what we know today in terms of the very broad range of alcohol harms. Excessive drinking increases all of these harms. Obviously, it increases the risk of becoming addicted, of having an alcohol use disorder. Quite often, conversation on alcohol and harms really focuses on addiction, but really this is not, sadly, the only problem. It increases the risk of being exposed to what's known as acute harms, the way that alcohol can harm you really quickly. I'm talking about alcohol poisoning, car accidents, obviously, injuries and violence, including domestic violence or sexual assault, hypothermia, suicides and homicides. And if you drink heavily over time, that obviously increases the risk of experiencing a chronic harm. And here we're talking about alcoholic liver disease, cancer, including breast cancer or colon cancer, heart disease and stroke, and alcoholic psychosis, among many, many other conditions. The CDC estimated that excessive drinking causes 178,000 deaths per year in the US. What's also very alarming is that since 2016, the number of deaths in the US related to alcohol has increased by almost 30%. And as OHA has documented, we are talking today about more than 2,500 deaths per year in Oregon. Another fact I really want to highlight that comes out of research internationally on the effects of alcohol and related harms is that excessive alcohol use is a major driver for health inequity. 1 liter of alcohol causes more harm to the poor than to the rich. This is a very, very consistent finding. I've included some flagship research in the links below to enable you to read more on the topic, but I think that is a very important aspect of the situation regarding excessive alcohol use. Next slide. And this is the data that OHA has recently presented. Once again, we see that a rate of alcohol-related death in Oregon has been steadily increasing for the past 15 years or so, with a very steep increase for the past 2-3 years. Next slide. And one way to highlight how excessive alcohol use drives inequity further this is the alcohol-related death by race and ethnicity in Oregon. As you can see, Native Americans bear a much greater burden from alcohol-related deaths than other populations. Next slide. And another ranking that we should not be proud of at all is that if we only look at what's called the alcohol-induced death, that is, it only includes causes of death that are fully attributable to alcohol, alcoholic liver disease, alcohol use disorder, and poisoning, for example. Well, Oregon now ranks 7th per the latest published data compared to the other US states. As you can see on the chart, New Mexico is way above. This is actually really alarming what's happening in New Mexico and Alaska. But in any case, the ranking for Oregon is not good at all. Next. And thankfully, there's been for decades extensive research about what works to prevent alcohol-related harms. And these are the top recommendations to prevent excessive alcohol use. These are based on an in-depth review of the research, available evidence by CDC and SAMHSA. And the one that comes out on top is really increasing alcohol prices. There is overwhelming evidence internationally that the most cost-effective action you can take to reduce alcohol-related harms is to increase the price. There are several ways to go about it. One way is to make sure that taxes are indexed to inflation. At least there is also minimum unit pricing that I will talk about a bit more. This chart highlights that, yes, OLCC to a large extent does have a role to play on each of these measures. Prohibiting sales to minor, obviously this is the daily work, a daily focus of the work of OLCC inspectors across the states. It's a major focus of all of our education efforts. Limiting days of sales and hours of sale, these limits are set by OLCC. Regulating alcohol outlet density, OLCC absolutely control the number of liquor store locations that we have in the state. Dram shop commercial host liability, we're talking about the liability, for instance, of a bar that were to be reckless in selling alcohol to over visibly intoxicated individual. Well, those laws are in place in Oregon, but in addition, there are a clear focus of our training and also compliance and investigation efforts. And finally, no further privatization of alcohol sale. Obviously, there's a recognition from the public health research that maintaining a control model is really helpful to limit harm. Next slide. And this is a presentation with the metaphor of the river, which is a central way to clarify what public health and prevention does compared to medical services. What is in orange downstream is really the medical care that the state of Oregon's medical systems have to provide every day. And we all know that providing treatment and medical care for whether we're talking about cancer, heart disease, alcohol-related injuries, car accidents, or even providing recovery service for alcohol use disorder, all of this is extremely expensive. So any measure that we can take upstream, as we know in this group, I'm sure, is really a very significant way to really bring about progress and reduce costs down the stream, and above all, reduce harm and suffering. Next. And I want to focus, 3 core actions, broad topics in terms of what OLCC does today. But in any case, thank you very much for the invitation. And what I really want to stress that we really want to pursue conversations about what else we can do in Oregon to reduce, to improve public health, obviously. Next slide. So OLCC is present across the state. We have local offices, especially for the inspector. We do adopt an education-first approach with the licensees and permittees, but the inspectors do on-site inspection. We follow up on complaints. We investigate when there is a serious concern, and when needed, when warranted, we take disciplinary action. This is what we do every day across the state. Next. And 2 things that are absolutely prohibited in Oregon is to sell, serve, give alcohol and recreational marijuana to any person under 21 and to any person who is visibly intoxicated. Next. And these 2 prohibitions are at the center of the very extensive education and training programs that are administered by OLCC. We have the mandatory alcohol server education that all bartenders must take and they have to renew it every 5 years to be able to have their OLCC card. We also have a training course for the marijuana worker permit. We also have a whole many other materials and documentations and training resources, and they all obviously focus on these two prohibitions. And obviously, I really want to stress this training program reached tens of thousands of people across Oregon. So making sure that they really emphasize public health messaging, updated content is really strategic to maintain a culture of public health and safety across Oregon. Next. Here's a key performance measure regarding the work we do to prevent sales to underage customers. So we have minor decoy. I'm talking about colleagues, younger colleagues, they're age 18 till 21, and their job is to try to buy alcohol or marijuana at retailers across the state. We keep track really carefully of what we call the passing rate. That is whether the retailer actually checked for ID and refused to proceed with the sale, in that case they passed, or whether they actually went ahead and sold the product to the minor, which is a legal violation. What's really interesting that we had to stop the minor decoy operation during the COVID crisis, and when we resumed this operation in the summer of 22, the initial rates were actually really low, around 60% on both sides for marijuana and alcohol, which was not acceptable. Overall, slowly but surely, those rates have increased. They are higher for marijuana at 87% than for alcohol. Obviously, it's a major priority for OLCC to improve the rate, especially for alcohol. The goal is to get a 90% passing rate. This is the objective set by the legislature for OLCC. Next. Another measure on here, we're talking about pricing policy, but OLCC was the first in the nation, and actually still today, I was very impressed to find that out, that set what's called the floor pricing policy or minimum pricing policy for distilled spirits. The idea is very simple. It was to increase the price of the lowest price spirits sold in Oregon liquor store. In terms of public health benefit, this measure is recommended by the CDC, SAMHSA, and WHO and the OECD at the international level. And the way OLCC went about it is that we set a minimum price on distilled spirits by alcohol content and container side. What is really interesting is that we set a higher minimum price for the very small, cheaper bottles, like the mini bottles or the tiny flask. And so I converted the minimum price to give you a sense of what this looks like per standard drink when we talk about 0.6 fluid ounces of alcohol. So the cheapest price for distilled spirits would be 46 cents if you buy a very big bottle. But if you buy a tiny bottle, a 50 millimeter bottle, the price per standard drink goes up to $1.33, which is actually really high. Next. And in terms of the impact, I'm not aware of any actual real world evaluation that was implemented in Oregon. If there are researchers in the room, please, if you're interested in the topic, we would certainly welcome any evaluation of the impacts. We did internal calculation on the sales, and yes, the 112 impacted product at the time, we did find out that their sale went down compared to similar products. But we did have a great modeling research published a few weeks ago by the CDC researcher, where they model what would be the impact of this policy very similar to that enacted by OLCC. That is, setting a minimum price only for distilled spirits, not beyond wine. And per their modeling, they estimate that raising the minimum standard drink to 45 cents, would prevent more than 8% of alcohol attributable death annually. We also had a great evaluation of Scotland's minimum unit pricing policy. In Scotland, they set a minimum pricing for all alcohol products, not just distilled spirits, and they also have very promising results, especially we're talking about benefits that benefits mostly men in the most socioeconomically deprived area. So we're looking at a pricing policy that actually reduces inequity, which is really great. a limitation, as I mentioned, is that OLCC policy only applies to distilled spirits. Some consumers may have switched to beer, cider, or wine, but as a reminder, tax and pricing regulation for beer, cider, and wine are set by the legislature, not OLCC. Next. And here is a quick one-slide summary of how taxes and pricing for alcohol is set in Oregon. As I mentioned on the right, OLCC decides the retail price, set the retail price for distilled spirits. In short, we buy bottles of alcohol from the manufacturer. We basically double their price, a bit more than that on average, and then that's the price customers get to buy them at the liquor store across the state. We have, as Craig mentioned, a very different system for malt beverage and wine. For wine, we're talking about 67 cents per gallon, a bit higher for higher ABV wine. And for malt beverages, the tax is 8.4 cents per gallon paid for by the manufacturer. Next slide. So this leads to a quite interesting system that we have in place. If we look at the most consumed addictive products that are legal to buy in Oregon, on the right-hand side, you have legal recreational marijuana, the other product regulated by OLCC. It's pretty straightforward. There's a 17% sales tax. So here, if you buy 1 gram of marijuana, 68 cents goes to fund public services, goes to the state, or actually for marijuana, it goes primarily to recovery services. If you buy a glass of whiskey, you also pay a significant part of the money that you pay goes into, again, funding state and local government services. If you buy a cigarette, we have a $3.33 tax per pack of cigarettes. So if you buy 1 cigarette, 17 cents goes into public revenue. But if you start talking about wine and beer, the amount per unit is much, much lower, as you can see on this chart. Next. And one thing I do want to highlight, because I've been talking about beer, wine, and cider as a shorthand, but products and alcohol manufacturers have been very innovative for the past 20 years, and we see more and more outlier, slightly confusing products. Here are some examples. The first one is Smirnoff Ice. One would think it's made out of vodka because of the name, but actually no, it's made out of a fermented malt base. So legally, it meets the definition, the Oregon definition of a malt beverage. So that's why it can be sold in supermarket, and no, it's not sold through liquor store. The second one is Four Loko. These are sold in very, very big cans. It was initially very explicitly marketed as an energy drink containing caffeine and taurine. Thanks to the FDA, they had to stop that, but they still exist out there. It's a very large can, more than 23 fluid ounces, a very high ABV, 13.9 for the version they sell in Oregon. And I know there is a lot of public health concern about this very product, but because actually drinking just 1 can is a form of binge drinking. And finally, another example is the Jack Daniel Ginger Ale, where it does contain distilled spirits, but the ABV is only 7%. So in Oregon, because of our current system, these must be sold through the control system. Next. The good news is that we do have an ongoing task force, as many of you know, that's precisely focused on looking into the benefits and drawbacks of imposing taxes on beer and wine. It's currently ongoing. I have the honor of being one of the staff supporting this important work. It is chaired by Representative Rep Sanchez. There are 20 members, including Annalise Dolph of ADPC. And this work is ongoing. The goal is to present a report to the Legislative Assembly by September. Next. And this slide summarizes also the range of regulations that are designed to keep marijuana products as safe as possible in Oregon. This is really a one-slide summary because the range of regulations that apply to the sale of marijuana, recreational marijuana in Oregon, are very, very restrictive. We have daily sales limit, we have maximum serving size, and there's a lot of work we do on product safety. One thing I would want to highlight, we started doing random marijuana product testing a few years ago, and we have initiated several recalls because we have found out that some of the marijuana product contain very concerning ingredients, in some cases that included arsenic.
Arnaldo, I'm going to do just a quick time check because I know we'll have lots of questions.
Oh boy, yeah.
Are you coming close?
Yeah. I think we're wrapping up with Craig presenting the new strategic plan.
Thank you.
Thank you for the reminder.
Yeah, to wrap up, last but not least, we've been engaged in building our, next slide, please. We've been building our new strategic plan for 24-28. It's not a detailed plan, it's a directional plan of where we want to go. I think if you get a chance to look at it, the first point we make in the intro is that we are a part of the ADCP's overall strategy. We have an important place, we believe. I'll ask you all a question, which is, are you comfortable with partnering with OLCC? Because I think it's a new opportunity, and I don't know that everyone is in the prevention community, because we are the owner and seller of liquor in Oregon. I think you can see now, hopefully, how we do that with the mindfulness. But our strategy is just made public. It's a directional strategy, and I want to show you, Debbie, I'll make this really brief, the next slide, which is, one, it was based upon a lot of engagement. You can see the engagement with our multitude of partners, including partners in this space of ADPC, Oregon Recovers, cities, counties. Slide, lots of engagement, and slide, please. The old mission statement is on top, and this is the new mission. I'm going to read out loud because I think it's important to take a pause with a mission statement, and this one unfortunately has a lot of words. OLCC oversees access to alcohol and cannabis products in Oregon through education, regulation, and distribution of distilled spirits, with the goal of protecting public health and safety, while supporting responsible Oregon businesses and generating revenue for local and state agencies. Slide. We meshed the mission, and that was the mission, the vision and values we meshed together, but we wanted to highlight two of the bullet points. One, that we want to be recognized as a model in managing and regulating alcohol, cannabis with measurable success in reducing harm, fostering responsible business practices, and supporting economic development. And two, we want to promote health and safety through evidence-based policies, quality education, and collaboration with folks like you, our public health and recovery community partners. Last slide. Thank you. Here's some of our key goals. Again, I'm highlighting our two on the bottom. The one we highlighted is the one I think you'll be interested in. We want to continue the partnership. And the bottom one, I cannot overstate how important it is to have a control model and maintain the control model with the restricted access to distilled spirits. Requires a warehouse that will allow us to warehouse and wholesale distilled spirits for the whole state. We're focused in the next 2 years in building a new modern warehouse in Canby. It's a significant investment in the control model. We think it's very much in line with the public health and safety efforts that you all are focused on. I think Arno showed that it is one of the evidence-based practices to address excessive consumption. And that bottom is going to be our main focus for the next 3 years, is keeping the budgeting and the construction online so we can move into the modern era with a new warehouse that will be sufficient, so that we don't lose the control model to advocates who would rather have the liquor sold through a lot more access points. Thank you so much. That concludes our presentation. Debbie, I apologize that we didn't leave much time.
Debbie, you're on mute.
Sorry, thank you. No, I think this was so important, and a lot of it was newer than what I had recently seen. I want to try and get to some of the questions here. Let's see.
I can hit the THC hemp question, Debbie, if you'd like.
Okay, go ahead.
So hemp and marijuana are legal definitions based upon the same species of plant. It's the same plant. Hemp is legally defined as the plant with 0.3% or less THC as a plant. Once it's harvested, that THC can be distilled down and concentrated, and that is an federally unregulated product. And so that is the product that is made available currently at the minor league baseball. Jess, hi, I didn't see you there, so thank you.
Yeah, I think that is something that we're finding with the Farm Bill and a lot of legislative as far as what's going to happen
Exactly.
with all of that. I'm gonna
Exactly.
Jess, go ahead.
Yeah, I just wanted to say hi, Craig,
Hi, Jess.
Arno. Nice to see you again. As the former public health policy analyst with OLCC, I just want to say thank you. I am so excited about this pretty significant shift in tone and direction and attention to public health as a partner and as part of your mission and vision. I am really pleased and excited to see this and to be able to partner with you in the future. So thank
We're
you.
honored. We're honored by that. And I just want to give Jess props. When Arno was saying we have a floor pricing system in Oregon, that's the only one in the nation. That is due to Jess's work. And we're very proud to have that legacy, but make no mistake, Jess served that up to us as we came in. We're very thankful for that policy move that she was able to implement with OLCC in the prior administration. So thank you, Jess.
Awesome. I'm going to get to a couple hands. I want to, one of the questions, how do distillery tasting rooms fit into all of this?
They're an exception to the 3-tier system. And over the 90 years that we've had the control system and the 3-tier system, there are exceptions for direct sale. And one of those is, so we license a distillery to serve their product on premises, which is an exception to the 3-tier system. And it's very detailed and lawyerly, and we still regulate it, but it's an exception, and I cannot do it justice. I'd have to have one of my legal experts help me with that, but good question.
Okay. Tony Biglin, and I'll get you next, Dwight.
Yeah, I just want to say, I agree with Jess. I think this is the most significant, the change in direction that you've defined here is the most significant public health development in Oregon in years, and I heartily applaud it. I put a bunch of questions in the chat, and I'm happy to discuss them with you at some other time. But
thank you, Tony.
3 cheers for what you're doing.
Thank you, Dr. Biglin. We appreciate that. And I saw your questions, and we can't do them justice now, but we'd love to meet with you and discuss them. Dwight Holton is on this call too.
I told you, we got the big players.
You got
You're-
everybody. Dang.
Craig, there is nobody better at public policy than you. So I have a public policy question for you.
Yeah.
With your breadth of experience, if given the change in tone and given the nature of the crisis we're in the middle of, if I were to say to you, what are the 3 most effective levers you have at your disposal to lean into addressing the addiction crisis? What are they?
Dwight, thank you. The control model itself, we take it for granted, Dwight, to have a control of the liquor, I think is the lever that we have to value as precious. And I don't want to lose that, because what that would mean would be we would just multiply by literally maybe 100 the access points for liquor, the higher ABV sales. And that's the lever that I'm most concerned about, Dwight, because I think it will be attacked as it was in Washington. So, but without a doubt, that's the #1 priority.
How about 2 and 3?
2 and 3, I mean, I think 2 is we're really focused on getting back to where we should be with minor decoys, resetting the need to have young people under 21 go in and try to buy alcohol. It was really stark to see that it dropped to only a 60% rate where they were denied. And so we need to work on that. And I think the third area is this area of this confusing area of hemp, a hemp product that has high THC. We're seeing, thankfully, as you all know, and alcohol consumption is dropping for Gen Z. But the concern is that hemp has let's be clear, it has no age gating. It has no age gating. It can be legally sold to someone under 21. And the Farm Bill, as Debbie said, I think that's the third area that's just the most concerning, is trying to get some loophole closure on that with our partners. And that one's hard because it's federal.
Craig, do you think that OLCC can help us reset expectations around prevention and prevention messaging? I was very discouraged by the kind of scorched earth attacks on Rethink the Drink, which is an excellent and thoughtful program. And that stuff back in December was just miserable. Maybe they didn't like one ad, but the whole point is the broader campaign was really carefully thought out and goes after this notion that it's not just binge and excessive drinking that's unhealthy. We need to reset the industry's expectation to understand that that's a part of the conversation we need to have if we're going to address the deaths. Can you help us with that?
Yeah, we got pulled into that pretty quickly, Dwight, and we support the Rethink the Drink campaign. I have been clear with my partners at OHA. I think it was a poorly executed one ad where it looks like, the wine went back on the shelf and all of that. But yeah, I hope so. And I think that we've made our support for Rethink the Drink clear, and we appreciate OHA and their efforts. And it's been it's a well-crafted long-term strategy, and we want to be part of it.
Good.
Thank you, Dwight. Jennifer, I saw your hand up. Did you get your question answered? Okay. One thing we had asked, because it came up regarding everything we've heard about Rethink the Drink. Wes is going to reach out to some people to see maybe if we can have them come back and share some information. I was on a Zoom the end of last week, and we asked some specific questions from the Rethink the Drink team at OHA, and they did. I'll be real honest, I could tell that they were extremely uncomfortable because they didn't even have a lot of answers. It was higher up, but they did give me something that was actually reassuring to me, that it was the campaign that was going to be, I think they call it paid media, that was similar to what was done in the winter. They would be pausing on that, but the effort that is still going on in the communities, with us being able to have dual messages with the Rethink the Drink campaign, is continuing. I think a lot of us were, hey, are we repeating what happened with marijuana? So again, I think it's really important for us when we're looking at this work to continue our advocacy and education work, where our communities can continue to do that while, you know, some of the big heavy lifting in these discussions that are brought up will need to happen. So it wasn't quite as bad as I thought, but we need to be aware of it. Tony Benza.
Yeah, thanks so much. And good to see you again, Craig. And what a sea change from the advocacy that I started doing in 2017 with Oregon Recoverers, and specifically focusing on OLCC's you know, responsibility to public health. So just really appreciate that. And for me personally, I would like to be a partner, you know, with ADPC in any way we can moving forward. My question for you is, the distilled spirit revenue, a lot of it goes into the general fund, and it seems like very little is going to, I'll just say, abate the substance use and substance misuse crisis. Well, what would be a pathway to reallocate some more of that funds? Like, who has the authority to, maybe I'll just ask, who has the authority to do that?
Yeah, great question. And so the Ways and Means chairs of the legislature, in the person of, I guess it's Senator Kate Lieber and Representative Sanchez, as you know, have the really difficult task of working with the leadership of the House and Senate. So, and that, Tony, that directing the funds and what funds are already going in after Measure 110. And I think Annalise is on this call. That has been a lot of the focus of the House Bill 3610 task force. And I've made it clear that we want to focus on the upstream and the social aspects of pricing, and really leave the distribution to the hands of those folks in the, you know, local government and in the state. And I think that's your advocacy point, Tony, is that's who's going to make those decisions. And I'm thankful that Governor Kotek and the legislature, I think, have made significant improvements in those investments. And I really feel like Annalise and the ADPC are much better suited, frankly, because you all have the overall responsibility, right, Tony? You have the overall responsibility for addressing the treatment of AUD and addiction, and ours is more on the front, you know, what's the upstream, if you will. And I want to make it clear that I think it is right for the control system to be focused upstream on the social access, the access to the alcohol and the price of the alcohol, and that's where I want to focus.
So thanks so much. So is the formula for the distribution of revenue set by the legislature?
That's correct.
Okay, thank you.
Yes.
Okay, thank you.
Yeah, and if you want, I'll have the 3610 task force is meeting tomorrow afternoon, and I'll go through that formula. If you want to join that call, I'll go through it. And unfortunately, it's very lawyerly and detailed, so bear with us as we go through chapter and verse of revised statutes.
Okay, thanks, Craig.
I want to make sure, welcome, Caroline. I saw your message in the text or chat too. Is there anybody's questions that I have not seen? I know there, Lindy had one. Did Oregon Health Authority have the chance to provide input into the strategic planning process?
I think we focused on Annalise, frankly, when we did our engagement and outreach, and we had so many people speaking into it. I frankly can't recall, because we used a contractor called Pivotal. So I forget if like Dr. Tom and Dr. Dean and the other folks that we know at OHA were interviewed by Pivotal, but I can get back to you on that.
And Craig, I can pitch in. triggered my memory. Yes, Tom was in an interview, I think with me. Yes. Thank
There you
you.
go. Thanks, Annalise.
Okay. Any other last questions? I think this is, well, we'll leave it at that. Any other questions? Craig and Arnold, this has been I think all of us feel like a little bit earth-shattering in all the right ways. And it is a pivot point. And please know you are welcome any and all times to attend this meeting. Your input is critical. And I think without us having a formal vote, we all were, yes, we want a partnership. We see this as a huge part of what we can do. And as we move forward with our strategic plans, making sure they line up and using all these great people here who, as we learned about Jess, too, as far as having that insight and the research and other things. So thank you so much. We just really can't thank you enough for the, I think the hope that you've given us going into summer. So thank you again.
Thanks. Thanks, Debbie. And it was great to see familiar faces and new faces too. So we look forward to the partnership and appreciate your kind words. Thank you. I'm going to have to step off, but very much appreciate being able to present to you all today.
Okay, thank you again, both. Okay, we've got 16 minutes, but I think we can cover that. Annalise, do you want to give some updates that you have for the ADPC as a whole?
Sure, and I'll try to be quick because I know I do just want to again thank OLCC for being such a great partner and emphasize folks that we are in the middle of the alcohol pricing task force process. So one of the things I really appreciate from OLCC is bringing an array of strategies to the table. I think perhaps folks have maybe been a little over-focused in the past on maybe just one pricing strategy when we actually have an array. And it does continue to be a strong discussion about where the money goes and the role of the ADPC in the future in kind of overseeing that. So stay tuned on that. The commission itself is going to take July off, give everybody a little afternoon back on July 8th, but all of the committees are really busy. The recovery committee proposed, followed the prevention committee with the settlement board this month and had a $13 million package approved to support recovery community centers in areas of the state with high overdose rates and incidences that don't have access to recovery services, and a small bucket of funding to Oxford House Recovery Housing. So that is extremely exciting. The treatment committee will be presenting next month on July 10th for their proposal, which I think a lot of folks have heard about, to greatly expand access to opioid treatment programs in the state. They're proposing 10 mobile and non-mobile medication units, which will carry us quite far as a state. So that's very exciting. We're continuing on in the hiring process. We will have a new policy advisor starting July 15th, who's going to be staffing the treatment committee. And we have a communications person, which I think you all will be extremely excited about, starting August 1st. That's really going to help us ramp up some of this education, connecting the research to the public and practitioners. I think it's going to be a really great opportunity for the commission. And then we are still working on another senior policy analyst to fill Tori's position and another research analyst. So those are our big updates. Oh, and our July 1st report will come out next Monday. But under statute, we are charged with providing a progress report in each even year. So this will be a progress report. It's actually the first one on the 2020-25 strategic plan. So there'll be a brief written report, a dashboard 1.0 that Will has been working very hard on so that you will have all of our indicators at your fingertips. And then a high-level smart sheet that has all of the strategies and activities for the entire strategic plan and the assigned agencies and their actions. So I think that's going to be a really good tool for committees to really track where we're at, so that we're not always kind of playing catch up and saying, did this agency do that? Did they do this? We'll have it all in a smart sheet that we continuously update. Those are all of mine, and happy to take any questions.
Any follow-up questions for Annalise? Okay, thank you, Annalise. I can give just a brief update on our ambassador team that is been charged with working with, is it PRR?
PRR.
PRR, okay. To help us go through the steps. I think we have a few of those individuals that are on that ambassador team that are also on this one. It includes also individuals that represent CLO, the Addiction Mental Health Planning Advisory Council that oversees the block grants. Individuals that have ADPEP grants with within their public health, and those that are outside of their public health, nonprofits, other entities. So we've had 2 meetings. We haven't been able to make our first decision, but it's been extremely great, robust conversations. We are really taking serious the charge to make sure these funds go to where our subcommittee wanted them to, and I think we're going to have a great opportunity, and we're getting good support from OHA and those that are involved with the settlement board. We have another item on here, update on work with Representative Walters, and I'll ask Pam and Tony Venza to help me with this. I'm going to just give you a little bit of my history. There was probably it's been in the making for 2 years. We actually had Representative Walters do a presentation at our Oregon Coalition of Prevention Professionals. She was interested in learning a lot more about that work. And through that effort, there was the discussions about, could we be doing more outreach, more education with legislators and maybe some of the people that don't always get to hang out in some of these meetings. And so that process was really actually started prior to my involvement with ADPC. And we were able to have our first meeting a couple weeks ago. And I think that one of the biggest desires that everybody has is that there's not duplicating efforts, but we're bringing different people to the table to be able to share and figure out, how do we move forward? Pam, do you want to chime in a little bit, and Tony too, as far as your understanding?
Yeah, the only thing I'll add, it was an opportunity again for new people to come in, and Debbie gave us kind of an overview of the history of prevention and what it has looked like in the state of Oregon. And I think, that was one of the main ideas, is to understand who was in the room. We do not want to duplicate efforts. It's like we want to be able to, we talk about the silos a lot, and we don't want those. We want people to be able to share ideas and share what resources are currently out there so that we can move as quickly as we can. And that was basically it. Our next meeting is in July.
Tony?
Yeah, sure. Thanks so much. So I'll just say, first and foremost, it's just nice to see the swell of support for prevention. My recommendation is that, and the reason I'm a part of the Alcohol and Drug Policy Commission is I see the Alcohol and Drug Policy Commission as an instrument to create sort of institutional change, not just legislative, but through the government agencies. And while there's a swell of support for prevention, I also see a swell of support for the Alcohol and Drug Policy Commission, and am very encouraged with the ADPC's progress over the last oh gosh, I don't know, it's 18 months, a year. We got new membership, we have new leadership, we have new staff, and things seem to be moving forward. What I challenge the prevention committee with doing is really getting concrete about where we're going and what we're asking for, and allowing those kind of tangible system-based goals to be put into the plan of the ADPC, which then can be leveraged across the state agencies and used with legislators to point to concrete things that we're going towards and where we're ending up. So I think that's the next step for the prevention folks, is to say, okay, we've defended prevention, it's primary prevention, you know, and I understand why that's an important strategy and the reason that it's such a focal point of the conversation so much. I think we've done a good job of that. You've done a good job of that. I make sure that I say primary prevention when I'm talking about, you know, ensuring people never start using in the first place. But the next step is, and to leverage the opportunity that we have politically and with some of the state agencies, is to say in 2 years, we're going to have this many of this and this much of this, and it costs this much. Like, those are the more finite details we need to have from a system perspective. So
Right.
To the legislators, great, they're participating. Let's keep using the ADPC to guide the conversation and to steer the ship where we're going across Oregon.
Thank you, Tony. And I think that was just kind of an update, because we'd heard some questions and want to make sure that no one feels left out. And you know, that full transparency. And actually, you know, I guess my hope is that those of you in your individual organizations, counties, you know, have conversation, education, advocacy, raising awareness with your county commissioners, with your school boards, with your city council. You know, I have a bumper stickers that says, raise the standards. If the people lead, eventually the leadership will follow. And that might be a lot of what we're trying to do right here. Tony, you had mentioned something that you might want to share with the group.
I've got it down to 30 seconds. I'm
Awesome.
sending an email to you and Annalise that describes the Learn and Lead Summit, Understanding Effective Systems and Delivery of Training and Technical Assistance. And they have experts from around the country presenting to try and strengthen the training and technical assistance. And they asked me, they had invited me, and they asked me if somebody from this committee might come to it. They got one slot left. If you got somebody for that, let's do it.
Hey, we will check that out. Thank you, Tony. Always keeping us on the cusp of things. I think because we had such an important presentation and discussion with OLCC, Wes and I were kind of texting on the side, chatting on the side, and we're going to go ahead and pass our update for the infrastructure work group to July. We'll be able to have, I think, that even more polished and finished for the group. We won't take July off just because we want to keep these things moving. And that, yes, thanks, Jess. We are going to, ADPC bylaws is we can have 16 voting members for our committee. But that does not mean that we only have 16 people attending our meetings. So we're looking for ways to make sure we have that diversity. We'll be talking to people about that and showing you that in July, so we can move forward. And if anything, we really want this, you know, we have to go by those bylaws, but we need, this is an all hands on deck moment. So thank you for the questions. Any other, I don't think, well, we're all here from the public. Anything that did not specifically get addressed that you'd like to bring up? We got 3 minutes of open mic time. I do want to share, in case you haven't seen it, Mara mentioned there was quite a bit of momentum and excitement at the Alcohol Policy Conference in Virginia in May. Once I get all the materials from presentations, I will share them with this group and we can make some connections with others doing alcohol policy work at the state and federal level. Thank you so much, Mara. That'll be great. Jennifer, since we have you here, Lindy, go ahead. Lindy.
Yeah, just really quickly, a thought I had. I really appreciated the OLCC presentation today and share similar thoughts to what have been already shared. But I guess one thing I just want to remind our group that we have a lot of work to do still. And that while we are doing some things really well with OLCC and in our state, I think we still have a long road. So I just didn't want to let that, with all the excitement and appreciation, I want to make sure we still recognize that there's a lot to be done.
Yeah, definitely. And it's so nice to know we have partners in this, and I think having that gives us even more clear direction. So thanks for reminding of that, Lindy. Jennifer, just Epstein, I know you're doing a lot of work with the new drug talk. You got a 30-second maybe update you could share with us?
Sure. Thanks for the opportunity, Debbie. So the new drug talk is an awareness program to educate parents and caregivers about the dangers of fentanyl and fake pills and how it is impacting youth, and to coach them on how to have ongoing conversations with the young people in their lives about this problem, and also about mental health. And you know, we know that SB 238 is going to require fentanyl education in schools, which is great, beginning in the 24-25 school year. So all middle schools and high schools in Oregon will be given curriculum by ODE, and you know, the kids will be getting it in schools, but maybe that's 3 or 5 days a week or for a year. You know, that it's only a few days a year that the youth are going to be hearing this in the schools. And so we feel like this needs to be reinforced at home, and the new drug talk hopes to help do that. And I encourage you to take a look at our website. It is free, and anybody who can help promote it, we would love you to. So yeah, thank you, Debbie.
Thank you. All righty, everyone. I think we got a little hope, but it's time to roll up our sleeves. I think I want to throw this out just real quick from Jess. Curriculum cannot be mandated by ODE, so if your school wants to implement, they may need support from local public health and public health partners. Jess, do you want to give a little clarity on that real quick?
Yeah, so the legislature often mandates requirements for the schools, which then the schools have to choose how they complete those requirements. And so ODE cannot mandate which curricula or curricular supplements that schools adopt. But in this case, they actually have created a supplemental curricula in partnership with the new drug talk that will be optional for schools to roll out as one of the options. The other option being, who knows?
Is that curriculum already written?
Yes. They were finalizing it over the summer and should be rolling it out before the school year.
I would love to see it.
I think you'd have to contact ODE, but just saying, all my clarification was that implementation of curricula often doesn't come with implementation support from ODE. So local public health departments or public health partners or other agencies they're interested in helping support their schools implement this curricula. There's opportunity there.
Yeah.
Jennifer, you want to give a quick update?
Yeah, I was just going to share that from what I understand that ODE, there's 2 curriculum developers that they have used and they're going to be using moving forward. The middle school curriculum is Carn Associates, and I believe they were given this project a while ago, and it's I don't know exactly the status on that. And the other one is West Ed, and and you know, what I understand is that they are still in development from what I understand, and that it will be a ongoing process. They'll have something for the beginning of the year, but that doesn't necessarily mean that's kind of the end product. And so it's still, they're still working on it from what I understand.
Thank you for that clarification. And I think, Tony, as we've all said too, that we're throwing something out here. We want to make sure it doesn't do any harm, and it is researched and can get on that evidence base. So I think we'll have a chance to keep having discussions on that.
Well, I have concerns about it because I can't imagine that you could develop a curriculum and not test it with small groups of kids. You could do, 6 different studies in a couple months to actually see if it changes the attitudes and behaviors of kids. So I've been concerned about it from the start. So.
Okay, we want to let everybody go that needs to leave, understand that, but I want to give Caroline and Pam, for those of you that can still stay on, the chance. So Caroline?
Yeah, I just want to make sure, since we're talking about the Department of Education, I do know at one of our meetings, we talked about them hiring a prevention specialist, and I really think we need to be involved with that. I really want someone there who understands prevention, because one of the biggest barriers that we've been having is just trying to understand what prevention is and the importance of the certification process and the importance of the research of prevention. I'm concerned that they might hire someone that doesn't have that type of experience. And I think we should have a say-so as the Alcohol Drug Policy Commission, that we should be on the interview panel or even in the screening. So I just have some major concerns, the fact that we should be partners. And if they don't hire someone with a strong prevention background, that we're going to have issues in the future. So
I have a colleague who ran a randomized trial of reducing youth alcohol use in 36 communities in Oregon. And then she asked me for a letter of reference. And then we found out that we can't give letters of reference. So she'd be a wonderful candidate, but who knows what's going to happen.
Pam?
Yes, I have a question. Like what you just described, is there an announcement, like our public health departments or within the counties or whatever, are they aware of what you just said so that they can have an effort to go up to let the schools know? And if not, would you put that in writing and I'll share it out?
You think that was to me?
Yeah. Just the way you described that, like this is how public health can help, with the curriculum, and because I'm picturing how it, how it comes down into the systems. Because I think people assume like, oh, everyone knows that blah, and it just doesn't happen that way. And so if public health, if community-based organizations like mine can help and reach out to schools and say XYZ, I would love to be able to do that.
Well, if the commission or the chair of this committee or Annalise wanted to whisper to the ODE about these things, that might be the way to have an influence.
Yeah, so that work is happening. So
good.
there are opportunities to communicate with districts to engage their public health and community-based partners to help in the implementation of this act. And that is also repeated back in the opioid fentanyl toolkits that the districts have available as well. There's a strong link back to public health and to preventionists as well. So I wanted to name that. The second thing is I have been asked, to Caroline's question, I have been asked to be on the initial screening. So there is ADPC staffing representation on the screening. They have not made any decisions with respect to the actual interview process. I'm not sure that the next round, but I can relay back that it'd be great if we could get somebody that's not me.
That's excellent. Do you know about the process of evaluating the curriculum?
The curriculum was adapted from another established program, is my understanding, and that given the legislative mandate and the timing, doing the evaluation that you're talking about was not feasible. However, they did engage youth in multiple settings to work through the curriculum and to get their feedback on their understanding of it and the applicability of it.
Didn't they get $1.9 million to develop that curriculum?
I think it was 2.9.
They certainly have the funds to do a series of evaluations that would increase the effectiveness across those studies.
Annalise, I'm going to let you be the last word.
Thank you, Debbie. So I just have a request of this committee because I hear a lot of assumptions being thrown around often in this committee about what agencies are not doing, what the ADPC is and is not doing. I think it would be really helpful if we started to think about things in terms of questions that we have. So if you have questions about a curriculum or questions about how the ADPC is working with the state agencies, let's start to develop those so we can get them answered instead of making assumptions about what is or is not happening. And then that way we can provide input, we can get our questions answered, and maybe move things along a little bit better. So that's my one request.
I think that's awesome advice for us to leave on. Thank you so much for the enthusiasm. We're making progress. Keep that up. And thank you again so much for everybody being here. Have a safe 4th of July. Thank you.
Thanks, everyone.
Thank you.